The COVID-19 pandemic has created unprecedented change and a need for a response from everyone around the globe. Many of us are worried about our loved ones and our livelihoods, and there is no one right way to cope with what we're experiencing. Remember, however you're feeling, there are others that feel the same. You are not alone. Here are a few voices of people struggling to cope during this time.
Some days I'm okay. I'm doing my best to adjust. But yesterday, I couldn't stop crying. This all just seems so unfair, and I feel so angry that this is happening to us. I'm struggling to care for my kids and work from home at the same time, and I'm worried about my parents' health. I watch the news and it just seems so hopeless. I don't know how to keep it together.
I feel so lost and sad. So much has changed. I used to have dinner every week with my family, but now I can't be in the same room with them. I really miss them.
I'm missing out on my prom and my graduation. I've literally been looking forward to these things my whole life, and I'm heartbroken.
With everything going on now, I just can't stop my thoughts. And physically, my chest hurts, and I can't breathe. I get nauseous thinking about what could happen to my family and my friends.
Before this happened, I used to worry all the time about getting sick. Now that worry has turned into absolute terror. My heart races every time I have to go to the store. What if I bring germs home with me? I can't stop washing my hands.
No matter how exhausted I am, my sleep is still terrible. I just keep picturing all the things that could possibly happen. Will I ever get a good night's sleep again?
I've been through so much already. I don't know how I'm gonna deal with this too. My flashbacks are getting worse and worse.
Honestly, I feel like I'm more comfortable in times of crisis. I'm not sure why I don't feel as upset as everyone else does right now.
I don't know when or if everything is going to get back to normal. I feel like the weight of the world is on my shoulders. How many people are going to be affected? What does this mean for me and my family?
We've just heard some of the ways people are being affected by the COVID-19 situation. Here are some things that are helpful in building resilience during times of crisis and intense stress. There are a lot of things outside of our control right now, which can be scary. By focusing on the things we can control, we can refuel ourselves and become more grounded and able to focus and cope with all of the things we can't control. One of the most important actions within your control is to follow CDC guidelines to reduce your chance of being exposed or passing the virus on to others. Use social support. No one should go through this alone. There is absolutely no shame in talking about what you're going through with your friends and family, and it's important to be there for others too. Video chat and phone calls are a great way to stay connected. Prioritize self-care. Staying on a regular schedule, exercising, eating a healthy diet, keeping a sleep routine, and taking time to meditate or pray are all important, now more than ever. Be gentle with yourself. During times like this, you will have good days and bad days. Your emotions are most likely heightened at this time. Try not to compare your life to what you see on your friends' social media feeds. There is always more going on behind screens. Helping others can bring joy and gratification. Do what you can to help others, even if it's something as simple as lending an ear or making someone smile. Be kind to the people around you, especially the folks who are still out working to ensure we all have what we need. If each day feels like an uphill battle, it may help to seek out professional support. To continue helping during this time of social distancing, many mental health providers are using telemental health in their practice. If you can't afford therapy or need to talk to someone right away, you can call the Suicide Prevention Lifeline 24 hours a day at 1-800-273-8255. You are not alone in how you are feeling. There are things you can do and resources you can use to cope during this challenging time. Check out our library for more videos to learn more about mental health, dealing with isolation, and ways to cope. We're all in this together.
I will be doing this presentation and focusing on mental health, specifically depression and anxiety, as well as suicide. So why is this a passion of mine, not only in the Philippines, but in the US, but also in the Philippines? This is the whole trend there, as it is in the trend here in the US. There are rising cases of depression and suicide globally. So because of that, I myself have my own clinic, my own practice as a nurse practitioner in mental health, where I prescribe medication, see a lot of patients. In fact, I just finished one right now. I've seen about 30 patients early on before this event. So it's always been a delight to help somebody in or having mental health issue. And I opened up the foundation called Help for Hope Foundation, which is really focused on mental health education, especially among Asian American here in the US, and most specifically the Filipino, where I don't mind seeing them regardless of their insurance system. If they are uninsured, I still see them, I treat them, all of because of mental health education and helping them out. So what is the background here of our mental health status? The World Health Organization, or WHO, identify the Philippines has the highest incidence of depression in Southeast Asia. About 4.5 million cases is reported in the country. However, I gotta tell you, if you look at the date, it's always been 04. Why? Sad to say, there is no proper reporting and timely reporting. So what it is that we are still one of the highest incidences of depression. When I say we, that means the Philippines in the Southeast Asia. 19% of adults suffer from mental issue in the Philippines, and suicide, major contributor is depression among premature mortality. The leading cause, the Philippines has the leading, 32% in the Western Pacific, and about 30% high in global average is the status of the Philippines when it comes to suicide. However, it's less talked about. We have stigma. There are some factors that put shame in discussing depression and suicide. The Philippines also is the most populous country in the Western Pacific, but the WHO said there is very little known about depression and suicide in our country. We in the Philippines are underreporting, probably due to cultural factor of non-acceptance, along with social stigma and the view of disgrace by many. This is how the study shows among WHO in where we are in our country, in the Philippines. Depression has a lifetime risk of about 7 to 12% in men, but it's about 20 to 30% among women. So there are more people, or there are more women reporting depression than men. However, I always question that statistics. Why? A lot of men have that sense of control or the shame of reporting. Well, statistics know if you don't say about it, you don't report about it, it's not recording. So be it. 7 to 12% in men, 20 to 30% in women. But I still question that. More women attempt suicide in the Philippines, but men are more lethal and they're more apt to succeed. So a lot of women will attempt suicide in the Philippines, but more men are successful. Even suicide in the Philippines is higher than, can you believe that? And it is. It's higher than China and India in ratio. And that's the study of University of the Philippines between 1974 to 2005. Sad to say again, there is lag in statistics and reporting. So suicide among adults are increasing. And in fact, I have to look at statistics, and it was divided into three. Why? People who experience suicidal thoughts because of depression, only 1/3 seek help. And among of those, 1/3 also suffer of the symptoms, but ashamed due to stigma. And another 1/3, or 33%, suffer the symptoms, but sadly do not know what is wrong or what they're going through. So that is the reality of what we're facing now. So that's why I'm also very encouraged with the invitation, because I've seen a lot of young folks here, our youth, who are actually the next generation. And if we educate them, probably there will be a switch and change of perception among depression and suicide. So depression, according to American Psychiatric Association, is a real physical illness. I really tag along with a video that you've shown earlier on. And I like it because, like any illnesses, let me take, for example, diabetes, where there is a chemical imbalance in the hormone called insulin. A person who is diabetic is more apt to seek help from their doctor and seek insulin, perhaps, to treat it. But it's not the case in depression. In depression, there is chemical imbalance, which is real, and this involves the neurotransmitter. If diabetes involves insulin as the problem, in depression, the problem here is what we call as the neurotransmitter of serotonin and more others like dopamine and norepinephrine. So if it's a real illness for diabetes, it is also a real physical illness that affects emotion and behavior when it comes to depression and anxiety. These chemicals, if they are imbalanced, would make a person feel depressed, feel anxious, that if in severe case can lead to suicide. Now, I like the video too that was shown earlier. Why? Because it says, it's a normal feeling to be sad and to be depressed if there are reasons such as death of loved ones. Of course, we feel those emotions. We're human. The problem is when it goes too long, that it affects your relationship. It affects your activity of daily living, your routine, and your source of income, as well as your relationship. Then it becomes a disorder. That is the time that you should seek help, and there is help. Help can be done through therapy or medication, just like your physical illness, such as diabetes or kidney problem or heart problem. There is no difference. The difference is our perception as people who judge others, that somehow our culture directed us that depression is something that is a sign of weakness or a wrath from God. That is a fallacy. So what is really depression? And what are the symptoms related to depression? You would say one is depressed when they manifest such as symptoms like feeling of unhappiness, sadness, especially the feeling of worthlessness, hopelessness. These depression, feeling of sadness, constant sadness, especially when a person says, I no longer enjoy what I used to enjoy. I feel hopeless, I feel worthless, and this starts to affect relationship, work, and your routine every day. Some people would feel helpless, some people feel sad or feel blue. That's when a flag that you could see this person might be suffering from depression. Depression also can occur early in life. Even kids can feel depressed, or it can coexist with other mental problems. What are these other mental problems? Such as what we call as bipolarism, the mood swings, or psychosis, when the person starts hearing voices saying things that are not there. Depression can also mix up with them. Or depression can be true to everyone else. Well, I have to let you know this time. Depression is an issue of mental health. Hearing voices, seeing things out of contact with reality is in the field of psychiatry. If I have to say it in our own language, there's a difference between depression and anxiety and who we call na buang. Buang means psychosis where they're not in contact with reality. But depression and anxiety is human experience that affects emotion and is considered in the mental health realm. So that means we exercise daily because we want to be physically healthy. Our emotion needs that resiliency too. And that's mental health. So there is a separation. Not everyone who's depressed or anxious is psychotic. So it's wrong to say na kung depressed ka, nabuang ka. No, there is no such thing as depression as buang, because buang in our dialect is actually psychosis, never a mental health issue. Although they share emotional symptom and behavioral symptom. So looking at, in a case of mild depression, you could be treated without medication. Just like your diabetes. If your diabetes, your new onset of diabetes, you could choose your food, you could do exercise, you could change lifestyle, no need for medication. But in a moderate and severe cases of depression, you need professional help, because especially when one attempts suicide or thinks of suicide. Just like your diabetes, when your blood sugar is become out of control, then perhaps you need that insulin. In fact, suicide is the major contributor to premature mortality as the leading cause. So what are the risk factors? So what do we mean by risk factor? Risk factor are factors that makes the person vulnerable to be depressed or anxious. Stress. Where does this stress come from? Day-to-day activity, demands from work, time management, relationship issues, financial issues. All this that you perceive as stressful can make one person vulnerable to develop depression along the way. Having experienced significant loss doesn't mean only death of a spouse or a loved one. Loss can also be meaning loss of job, loss of income, loss of housing. Those persons who are experiencing trauma or long-term illnesses, our elderly population, also may experience high risk for depression. Family history, I want you to remember this. Depression is depression and anxiety is very familial or genetic predisposed. So if you have family that actually are depressed or anxious, somehow it is inherited through the genes. It's the same thing, the color of our hair, the color of our skin, the color of our eyes. We take it from our parents. Our emotion, our behavior also is a good determinant for a person's emotional state, such as depression. Especially among Filipinos, we have very good resiliency coming from our spiritual belief of whatever it is. So another risk factor is lack of spiritual and social support. People who work a lot and without social circle to support them are more at risk to develop depression. And those who lack spiritual support or guidance or belief and practices may also, you would see later on in another slide, it would identify that there are factors that may halt or delay depression. Low self-esteem, people who experience bullying, people who experience being shamed, may it be in person or even in social media, it increases their ability or their chances of feeling depressed. And also people who may have substance use disorder. Well, let me tell you a little bit background too. When I was helping Cebu City government in trying to facilitate and develop the first mental health and behavioral health law in 2016, crafting a city ordinance, what actually stimulated our discussion are the cases of depression, suicide, drugs, and rising STD, and not to mention rising HIV. We were able to look at a group of young adults, and this seems to be very common in Cebu as well as in the Philippines. But Cebu is one of those cities that's suffering around this: anxiety, depression, suicide, HIV, as well as drug use. And who are these that we isolated? We were able to isolate the young professional working in the call center industry. They probably have suffered a lot of stress coming from the different time zone. Even when it's morning in the United States, it's evening there. They have to be awake. The culture, U.S. and Western world is so assertive. They demand, they even yell, while our call center are being screened. Our call center workers are being screened, being tapped, and being monitored, that they have to be calm. They have to be very, very customer service oriented. But at the end of the day, their anxiety is growing. So how do they cope? We don't have enough mental health and behavioral services that they can go out and talk to and support them. So what they know are friends. They gather together, they probably drink some alcohol, do some drugs, having some promiscuous sexual activity just to relieve their stress out. Or those highly spiritual and religious keep it to their heart without able to express them out. And they develop depression until it gets so severe that they're thinking of there's no way out but to commit suicide. Those are what's going on in our present community. Again, in the US, it's the 10th leading cause of death. What is unique is that in the US, its highest incidences of depression and anxieties among people greater than 80 years old. The culture is different here. There is less community, and people work, the family work in their productive years, so there is less interaction and they're put in a nursing home. That's probably the reason why there are a lot of depressed. That's not the case in our country. But what is also very, very striking is the statistics shows in the Philippines that depression and suicide are highest among adolescent and young adult. We have a unique way of statistics in depression and anxiety different from the Western world. So what are the symptoms of depression? These are low or irritable mood in most time of the day. Either they're so quiet, they isolate, or they get so irritated. There is such a thing as a positive symptom of depression and negative symptom of depression. I'm just gonna summarize the symptom though. So when we say negative symptom of depression, negative means something is taken away from your being. So this is now the symptom of being silent, being withdrawn, doesn't eat, doesn't take a bath, right? Very, very submissive. The positive symptom of depression is characterized by, when we say positive, something is added on to your emotion. So instead of it's either being quiet, a person can be also very agitated or easily get angry. In our dialect, sapoton, irritable, daling manuyok, daling mairitar. When it comes to food, negative symptom of depression, a person may not eat or may lose appetite to eat. However, a positive symptom of depression can also be overeating. So that's why many people who could be depressed are gaining weight, because they go to food as their emotional crutch. Sleep, for example, a negative symptom of depression in sleep is they sleep a lot. They sleep more than hours of the day, about probably 12, 15 hours of the day. It's hard for them to get out of bed. The positive symptom of depression is when they cannot sleep. So it's either insomnia, not sleeping, or hypersomnia, too much sleep. This is on top of feeling worthless, hopeless, guilt, and hopelessness. They may have difficulty of concentrating, and they may have what we call as physical retardation, meaning psychomotor retardation. The mind does not allow the body to create and be motivated to do any activities. And this seems to be what I was referring to earlier on as I summarize it. And lastly, when a person is depressed, there is also lack of sexual interest. There is lack of sexual libido that may also affect relationship. I've mentioned already before what are the stressful life events that may trigger depression, such as abuse, long-term illnesses such as cancer, failing a class, illness in the family, loss of job, long-term pain or chronic pain, and social isolation, especially like in the video it mentioned during this pandemic. What are some warning signs of that you can watch for a person who could be depressed that's severe enough that they may have suicidal ideation? They may write notes, and the theme of their notes is death. Threats may be direct statement, such as I want to die, or I want to kill myself, or indirectly saying the world doesn't need me anymore, or the world is better off without me. They may come as jokingly saying in school assignment that it's over with. Now I got to tell you, even jokes about suicide should be taken seriously. People does not express it freely. They may express it in their arts, in their jokes, in their story, but look at not how they presented, look at the content. They might be jokingly externally showing you they're laughing, but they're actually meaning what they are saying. It is very important for you to be sensitive. They may have some final arrangement behavior, such as giving away important possession in their life, their favorite artwork, their favorite t-shirt, or as simply as their favorite pen, because they are giving this away. Their effort to seek help can be various behavior to seek others be sensitive of how they're feeling. So it creates a lot of importance for you to be looking at their behavior. Now, let me tell you too, among people who are depressed, the highest incidence of a successful suicide is when they are not, I'm saying not, in their height of depression. If a person is in the height of depression, they don't have the energy to commit it. They think of it, they think it over and over, but the body is so tired to do it. The problem is when depression starts to leave, that they will start to have energy. The thought is still there, the energy starts to come back, and then they will consummate the act. So people who are quiet, who are withdrawn, they can be depressed. Of course, we watch them. But as the depression starts to improve, they start to interact, they start to move around, that's when they do it successfully. I want you to be very, very aware of that. So what are some protective factors for depression? Well, they need to learn coping skill. That's when we have therapies. Sad to say, there's very limited therapies in Cebu or in the Philippines. That's the reason why we created and we help out with your city ordinance. With the city ordinance of the behavioral health of the barangay, it was funded for 80 million. One of the projects is in Lahog, where there is a mental health center in Lahog. Hopefully it runs right now. But I went there and visited that area, and it was built up there. Access to care and medication. I've mentioned before, like diabetes, we need medication to balance out the chemical in our body. We would like them to restrict access to highly lethal suicide objects such as guns should be kept and should be locked. Support systems such as family, church, and community. Skills in problem solving needs to be supported to allay suicide. And cultural and religious belief is a big factor, especially in our community. And we would like to instill sense of hope. And that's the reason why I built up my foundation called Help for Hope, because people who are depressed and who is anxious as well as suicidal, always do certain behavior to seek help. They might not be able to express it overtly, but if you watch closely, they may do telltale signs for seeking help. But if you're not sensitive enough, they will feel more abandoned and not being cared for. So what is needed? We talk, we ask, we listen. Talk about how they feel. And it's not wrong to ask if you feel depressed, or ask, make it a practice that when you talk about depression. Our goal should be making depression a household discussion. If we talk about hilanat, if we talk about panohot as a household discussion, talk also about emotion. It should be normalized by talking it so that they will able to express. Listen, do not put it under the rug. And when they express out their depression, ask them directly, do you have any thoughts of killing yourself? For a depressed individual, a lot of depressed individuals cannot express the thought of suicide or the word suicide. But when somebody else asks them, do you think of committing suicide? For them, it is very meaningful that somehow somebody is sensitive enough to identify how they feel, and they start opening up. So talk, ask, and listen. Spend time to look at a person's eye or straight on the eye. Don't just sit down and talk while you're watching your cell phone and the other person is watching another cell phone, and it seems like you're talking, but you're communicating to somebody remotely. Be with the person at the moment. So protection strategies that can help, protection and safety should be highest priority. What does it mean? If you ask a person who's depressed, do you have any thoughts of committing suicide? And they will tell you, yes, followed up with the next question. Do you have any plans? Unsa imong plano? Because that alone, that two questions alone communicates care and interest for a depressed individual. That should be your priority, and then seek help. So what are myths and facts about suicide and depression itself? I would like to share this so that you probably will be able to guide yourself here. Fact number one, talking about suicide will not cause a person to kill themselves. It's a wrong notion to say, ayaw mention of suicide, you're giving that person an idea. No. Talk about suicide, ask about it directly. It is more caring for a person who's depressed to hear that somebody is acknowledging their fears and their emotion. Fact number two, few suicide deaths happens without warning. You'd not tinood nga maingon ka nga, hala, ni kalit lang suicide. No. If you stop, look, and listen to these people who committed suicide, there are telltale signs that they manifest. The sad part is some culture neglect it or put it outside the rug. They might be crying, they might be telling you, and then somebody will just say, no, don't talk about it. You're just a weakness. Just pray, right? They give warning way before it happens. It is not something that just happened overnight. Direct question about thoughts of suicide directly, we talk about that. Fact number four, depression and anxiety and mood disorders, as well as substance use, as well as conduct disorders are most common factor found in suicide individual. So people who are suicidal usually have background, they're depressed, they're anxious, they could have mood swings, especially bipolar, or they may be suffering from substance problem. Fact number five, youth most commonly share their thoughts and problems and feeling with other youths. Always remember, in order to get the minds of the youth and know how they feel, be a friend to them. Even if you're parents, of course there's respect, of course there's authority, but do not be so strict with this youth. They relate with other youths, so why not be friendly to your kids? I'm not saying don't discipline them. Put that authority, put that respect, but be friendly in reaching out to them. That's when you know what are their thoughts are. 6, people who show marked and sudden improvement after a suicide attempt or depression period may be of great danger. Remember what I told you. Success in suicide happens when the depression starts to improve. Fact number 7, suicide is not painless and it's not an easy way out. A lot of people would say, oh, they committed suicide because it's their easy way out. No, they thought of it over and over before they act on it. Fact number 8, suicide is preventable. If you only show interest to another individual, a genuine concern of being caring, you could prevent one life, one at a time, by stopping, listening, and show you care. Thank you so much for the opportunity of sharing my passion to our community,